Hey everyone, Dr. Harmon here. Today I'd like to talk a little bit about liquid rhinoplasty. I'll talk a little bit about what it is, what it could be useful to treat, and what some of the downsides might be as compared to a surgical rhinoplasty. A liquid rhinoplasty involves the use of hyaluronic acid filler placed in select areas of the nose to achieve certain aesthetic results. And there are really two things you can do with hyaluronic acid filler in the nose. The first is you can reduce the intensity or peak or severity of a bump on the bridge of the nose. And it involves placing filler in the center of the nose above it. Now, you need to find the right injector who can counsel you on the benefits and risks and can do this technique properly, placing the filler at the correct depth and the correct amount. The second location it can be placed is at the tip of the nose, again, in the center, and it can be used to create the illusion of a lifted tip or a more projected or defined tip. Again, you really want to find an injector who's experienced and who knows exactly where to place the filler and how much to place in this location, not only from a safety standpoint, but to achieve the results you're seeking. Now, by definition, filler is additive, not subtractive. You can't remove things with filler. And that's one of the major downsides of filler. While it can mask, for example, a very severe or sharp hump on the bridge of the nose, you really need to do surgery to reduce that hump, to smooth it out, to fine-tune all the minor imperfections in the bone and cartilage that comprises the bone. Similarly, the nasal tip is very complex, and there is a combination of cartilage removal, cartilage strengthening, and specific suturing or stitching that's required in order to achieve very specific, very well-defined tip results that can't be achieved in most instances with filler. Filler, however, can be really nice for someone because it involves little to no downtime, and it is outpatient, and it doesn't involve going to sleep. So whether you decide to move forward with a liquid rhinoplasty or a rhinoplasty utilizing hyaluronic acid filler or a surgical rhinoplasty, it's important to talk about what you're trying to achieve, what your desired downtime is, and then have a conversation with the professional who's performing it about how best to reach that goal.